Okay, so we're talking to our podiatrist Marcus today about warts. Marcus, tell us about what exactly a wart is, and is it often mistaken for something else?
Wart is a family of the human papillomavirus, so it's a viral growth basically. And yes, they're often mistaken for corns, callus, those sorts of things.
So we really support that if you think you have a wart or it's been treated and it comes back, come see our foot specialist because it can be mistaken and treated for something else.
Yeah, so tissue stress sort of invokes a thickening, hard callus, particularly across like things like the metatarsal heads or the balls of the foot and that sort of thing. So if you're getting callus build up in exactly the same place on both your feet, it's quite unlikely that it's a wart.
Yeah, that's a good point. So tell us about best practice approach for wart treatment, what you have researched and used.
I've sort of given up with like the cryo, the freezing, the burning and the acids and all of those sort of very DIY home remedies. Just never got fantastic results. Patients end up coming back again and again and again and again, and the recent literature suggests the effectiveness or the efficacy is very, very low in occlusive, so duct tape or destructive therapies with mild acids and freezing. So the way the freezing works is it produces a cold blister underneath the skin which breaks the tissue down. The acid basically burns a chemical burn through the tissue. The occlusion or the higher urea creams with duct tape and that sort of stuff basically macerate and rubberize the tissue.
And we've seen a lot of that where people have very painful spots in their feet because it's hard to control where they burn.
Exactly. Yeah.
So what is it that you use?
So I like the Falknor's needling technique, which basically is a local infiltration on freezing of the area with local anaesthetic, so it goes numb and frozen. And then I basically debride or trim down all the hard skin, and then use a small needle, and I basically push all of that wart or verrucate tissue deep into the foot, so that the human body's natural immune response, those macrophages, those white blood cells and everything, all come and attack that sort of virus, and they're aware of the virus in the foot.
And I found that fascinating because there's several different types of warts, and so what you do is you identify how many types they have and treat one of each type.
As best you can. So like the most common is verrucopedis, which is a really large sort of bulbous type growth whereby the skin erupts and gets pushed out because of the growth at the lower levels of the skin. And then you get sort of mosaic warts, and which are very flat, lots and lots of smaller ones, and then you get some clusters of ones, and you can even get warts that grow under and around the cuticle or around the nail.
I find that fascinating because it's really evoking an immune response.
Yes.
And letting the body look after it. And so the effectiveness of this treatment is what?
Basically that once you've got that antiviral antibody response to that particular wart, you'll never have that wart again. But bear in mind there's the caveat that actually last research, I think off the top of my head, there's like 40 or so different types of warts associated with a foot, and then the human papillomavirus umbrella includes cold sores and other bodily warts and that sort of stuff as well.
Right. And so Falknor's needling, is the research telling us the percentage of effectiveness rate?
Oh, hugely higher than any other DIY type methods.
Right.
There's some drawbacks though. It is a surgical, like sterile procedure, and you'd have to come into clinic to do it, and then there's recovery time and healing from a wound and that sort of thing. But it, in my opinion, it greatly outweighs the whole sort of having a wound that you've made yourself in your foot for a prolonged period of time and never getting that recovery sort of aspect.
All right, thank you.
Pleasure.